Hey everybody, this is Nick Shewart. I'm here with Jan Diana and George Barroso, and today we're going to be talking about HIPAA compliance for development and test data. How you doing today, George?
Good. How are you?
Not too bad. Thanks for coming in.
Thanks for having me.
Yeah, absolutely. Glad you can make it. So tell us a little bit about yourself. As far as development and test data, how does that play into your daily life? How long have you been in this industry?
So I've been dealing with development and test data for well over 10 years. We handle, de-identification, masking, redaction, whatever some folks call it, obfuscation. But essentially, we've been doing that for our clients for 15 years or so, specifically around HIPAA and healthcare. We've been doing that for clients since 10 plus years now. And then was our first healthcare client. So you could say we have a lot of experience in helping them make sure that they have HIPAA compliant data in the development and test environments.
Very cool. Very cool. Obfuscation, by the way, that's a new word for me. I got to write it down.
Oh yeah, there's all sorts. They come up with one every.
Yeah, they do. Yeah, we were just talking yesterday about interoperability. It's like okay, synergy would work pretty well too. But
that's right.
Another thing you mentioned was HIPAA. What exactly is HIPAA? Why is it important to software developers?
So HIPAA stands for the Health Insurance Portability and Accountability Act. It's basically a law that protects patients' medical data, or protected health information. That's abbreviated as PHI. So you hear a lot of people talk about PHI. That stands for protected health information.
Okay.
And it's very important because if you're doing development, there are very strict regulations and kind of rules about how you handle the data, who's supposed to have access to the data because it's protected.
Right.
And so if you're, a developer at a healthcare firm or, some company that's dealing with healthcare data, you do have to be very careful about how you handle that data because if it's not de-identified or, masked, obfuscated, however you want to refer to it, if it's actual data, then there are very strict rules about who's supposed to see it and how you handle it.
Right.
So that's why it's important to consider because if you violate those, then you have legal and financial issues.
And nobody wants those.
Nobody wants those.
Not in this day and age.
Of course. To follow up with that, of course, what risks are associated with using real PHI in development environments?
Well, so, in production, you always have, everything's very locked down. And so you're going to have your real health information in those systems. But when you get to development and testing, they're not going to put the same controls around those systems, and many more people are going to have access to it, right? A production system might be a bunch of folks in a medical office that can see and use the system. But if you're a developer, they might send some of that development offshore. They could send it to, a third party here in the United States. But there's going to be a lot more people accessing the data and looking at it. And so if it's not protected, encrypted, obfuscated, de-identified, all of that PHI is in the clear, right? And that means that all of those developers, have access to it. They can see people's names and addresses potentially. Some sensitive health information could be there. And so it's a big risk for companies to have these development and testing systems that are not protected.
Right. That makes sense.
And then that opens up and increases your risk, right? Because in production, maybe you have a few systems where people access it. You maybe have 100 people accessing it if you're a big. But in development, you might have 1,000 developers. That's 10 times the risk if you just look at pure numbers.
That's right? A good point. I didn't think about that at all. That really opens up the floodgates potentially.
Correct.
Okay. So are there methods to help de-identify PHI?
There are, and actually HIPAA specifies 2 accepted approaches for protecting PHI and using it outside of the production scenario. One is called the safe harbor method, and we'll talk about what that is probably in a few minutes here. And the other one is expert determination. Both of them are accepted, and they're actually in the HIPAA regulations too. But those are the accepted methods for handling data that's going to be used in development and testing.
Interesting. Okay.
Awesome. So you mentioned you did mention one of the 2 methods would be the safe harbor method.
Yes.
What exactly is it when it comes to the HIPAA compliance?
So the safe harbor method is essentially a strategy for making sure you can de-identify your data set. And, HIPAA, the regulations lay out the 18 identifiers that are required to be de-identified or protected, treated. Things like names, addresses. Technically, it's geographic data smaller than a state. And so that means, your street, your city, and potentially some parts of the zip code as well. Right. There's some very strict rules around that. And then, social security numbers, there's medical record numbers, but there's a whole list of 18 that need to be de-identified in your data set in order for it to be considered safe.
Right. That makes sense. We don't want to just disseminate our information into the world, so that would make sense. We want to make sure that it's safe.
Yeah. I hear data's kind of important these days. So, based off of that, you said there's 18 identifiers. Are there any specific challenges? Because you say things like social security number, addresses, things I wouldn't want out in the public. Are there any specific challenges when it comes to protecting those with the safe harbor method?
Probably the biggest challenges with protecting those is making sure that the data is still usable afterwards.
Okay.
Right? It's easy to say, oh, well, that's no problem. I'll just replace it with all X's. Right. Great. But if you've got business logic that's going to go and, give you some report based on zip code, and all of a sudden it's, all ones, that's going to be useless.
Right.
You no longer can tell whether or not that report's going to work. So the biggest challenge is maintaining utility when you're making changes like this.
Okay.
Right. That's the biggest kind of challenge with the safe harbor method, making sure that the data, after you're done treating it, still has usability for whatever you're testing.
Got it. That makes sense. Okay. I could definitely see that.
Right. Well, now that we understand what the safe harbor method is, would you like to do a little bit of a deep dive into the expert determination method?
Yeah, sure. It applies to HIPAA. So the expert determination method is used generally when you want to maintain the maximum usability or utility of the data. And really what that is you have a qualified expert that analyzes your data set, and you might have already removed some of the protected health information, but they'll analyze the data set to make sure that whatever you're sharing out to your third parties or whatever you're using internally for development, there's no risk of looking at that data and being able to re-identify that back to the original person that it belongs to.
Why?
That would be something like, if it only had, let's say, my test results from my last physical, but there was no indicator of who it belonged to, like my name wasn't in the data set, my address wasn't in the data set, my medical record number wasn't in the data set. It was purely used for just, okay, here's some test results, right? And it was kind of completely disconnected. The expert could say, yes, this is safe to disseminate because it doesn't you can't tie it back to anybody specifically.
Okay.
Yeah. Okay.
So I have two questions there. First, say that information, that data was sent back to a medical professional. Is there a way to re-identify? And then second, you said that there's experts that use that method. Who qualifies as an expert in that case?
So the expert is someone who actually, I'll answer the expert part first.
Yeah.
The expert is actually somebody who has enough knowledge and understanding of the data set to be able to apply the statistical and scientific methods required to prove that you can't re-identify it.
Okay.
So, and that does apply to that specific data set. So if the data set changes and you add a column or you add a bunch of data, the next time around, now you have to go back, the expert has to go back in and recertify that is still safe.
Got it.
To address. And then the other question was, can you re-identify the data?
Right.
Potentially, yes, depending on what's in the data set. It will be up to the expert to determine whether or not that re-identification risk is enough to worry about, or, let's say, for example, there was some internal identifier or token for each record, right, that only you had or only your company had. And when you shared it out, there was no way anybody could figure out that, number 3 belongs to me and number 5 belongs to you.
Gotcha.
Right? Because it's just random.
Right. Okay.
In that scenario, then yes, when the owner of the data gets it back after the analysis, they could go in and map those back to the people.
Okay.
And that's a very common thing that companies will look to do when you have to basically send it out for analysis and then get the results back and kind of marry that back with the regular data to determine, whatever they're trying to figure out. Re-identification is possible
Okay.
in those scenarios and desired in those scenarios.
But it sounds like there's good checks and balances there in that process.
Yes, there has to be.
Absolutely.
Otherwise, it would be too easy to reverse. I mean, reversing it is the big problem.
Right.
Okay.
Right. I actually have a little bit of a compound question when it comes to that also. The expert itself, now, is this a literal person? Is there some AI attached to that? Or can there be some AI attached to that? Could it be an automated process, or is it a literal person? And then also, in addition to that, how does this differ from the safe harbor method as well?
So traditionally, it has always been a person.
Okay.
Because you have to have knowledge of how the data is used, what's stored in the data, and have information about whether or not you could re-identify. I'll give you actually a real-world example.
Okay.
Not from the healthcare space. This is from retail.
Okay.
But I think it applies and kind of illustrates what I mean by have to have knowledge of the data. So we were doing the identification for a retail customer. They had their membership, program, which had people's names and addresses and their membership number and the things that they purchased, and you could get rewards points for all the things that you buy there, and then use your rewards points to buy other things. So
Right.
They had this database with all of this information in it, and they said we have to go and mask all of this data because we want to use it in development. We don't want people to know all of the personal information for our customers. So we went through, we did all the things that they identified as being sensitive. They gave it to one of the team members who was trying to find his own record because he was also part of the rewards program.
Right.
And so everything had been de-identified. The membership number, his name, his address, everything about him was de-identified. What was not de-identified was the store number, the register number, the item that was purchased,
Interesting.
and the purchase price.
Oh, wow. Okay.
So you'd think, well, how would you ever get back to that?
Right.
Right? Well, he knew that he had bought a kayak, let's say,
Yeah.
somewhere recently. So he grabbed his receipt, right?
He checked the data.
And he checked all that information,
Yeah, it makes
found his record, which found his, de-identified version of his membership number, let's call it 123.
Right.
And then he went and he could go to all the other tables because he had knowledge of the data set. He could go to all the other tables and reproduce his entire purchase history
Very cool.
that was in the database.
Very interesting.
So, then we thought, okay, well, it's this one guy who knows the data so well. He's a quote unquote expert, right? So, how would you get somebody else's information?
Right.
So he went out on social media and did a search and found like 50 people that had posted their receipts. Oh, look at this great new purchase I got this kayak, or I got this whatever, right? So then he started searching for theirs, and he found theirs. So we came back with his results. We realized, there's this huge kind of re-identification risk because of the fact that people are now posting things like this. They don't realize it's sensitive. It's just a receipt.
Yeah.
It doesn't have their name on it.
Right.
But they were able to reverse that and get the information back.
That's very cool.
Right? Social engineering, it's been.
Yeah, very cool.
But so we ended up having to go and, we did some analysis with the customer and realized, okay, well, if we change the register number and we change the store number and we modify the price amount, we're good.
Interesting. Very cool.
Right? Because how many kayaks should they sell a day?
Right. Yeah.
And so that was enough to where he went and got a new set of receipts from, social media postings or whatever.
Mm-hmm.
And then after we went that extra level, he wasn't no longer able to re-identify.
Oh, wow.
But that's an example of expert determination, right? A normal person looking at that without any personal information, doesn't have anything that makes sense. But they also didn't know that if, the register number, the store number, and the a price amount was enough to uniquely identify that transaction
Right.
and tie back to a person.
That makes sense.
So
Very cool.
yeah, that's an example of the expert. And how does it differ from safe harbor?
Correct.
Safe harbor is rules based. Basically, if it's a name, you mask it. If it's a social security number, you mask it. If it's whatever, if it's one of the 18 identifiers, you just go in and you change it.
Awesome.
Right?
Okay.
But, obviously expert determination, you have a little more flexibility because, maybe the social security number isn't stored in a format that makes it obvious that it's a social.
That makes sense.
Then maybe it's not so easy to determine, and it might be fine based on expert determination that, that can be left in the clear because you can't map back to anybody. You don't even realize it's just a 9-digit number. Right? I had one client actually that said, I don't need to mask social security numbers in my systems because our account numbers are also 9 digits. And then we have a bunch of other 9-digit numbers that's we are storing. And the column isn't labeled social security number, so it's just a 9-digit number. You have no idea what it is.
Right.
Interesting.
Very
right. So for them, their info sec not that was enough of a risk.
Right.
That's interesting.
So, there are differences like that. Safe harbor is quote unquote safer,
right?
Because you're changing everything that could be sensitive.
Right.
Expert determination, though, is maximum data utility, right? Because you're not changing it, but you're just making sure that the data set can't be read.
Right. That makes sense.
Okay.
Interesting.
So just to be clear, I shouldn't be posting my social security number online anymore.
Oh, you absolutely should not. And you probably think twice about posting any receipts.
I mean, I've got like 2 kayaks, so I was like, wait a second. No wonder my identity's been stolen so many times.
That's right.